one of the things that you have brought up twice now that I don't think people talk about enough is how to breathe correctly, how to breathe in a way that helps to relieve the physical, chemical, and emotional stressors and not further distort our body's physical structure. Talk to us about just the critical nature of nasal breathing.
Well, just look at it. One of, I would say, the most basic, fundamental first motion and motor pattern that we learn is our breath, right? A lot of people think I'm breathing, so I must be doing it right. That can't be causing a problem. I mean, we know that's, again, you and I know that's not the case, but I have to bring that to people's attention, right? Because like, no, I don't think it's that. So breathing was intended always through the nose. I've read like Breath from James Nestor and The Breathing Cure. And they point out, like, you look at these old skulls, like 100, 200, 300 years old, and or even probably even longer than that. And it's a different shape. The nasal passages are bigger and we're able to breathe through the nose. But now over the industrial age, and that's where that kind of points to in the research, is now we have more long face because we're breathing through our mouth more. Our mouth was never meant for breathing. Our nose was. So a great way to think about it, and you mentioned it, physical, chemical, emotional stress. Breathing functionally, in this way that we'll describe, helps, or even dysfunctionally, can either affect or help the biomechanics of your body, the biochemistry, and also the psychology. So that covers all of them. And when I look at this for my patients, for clients, for the audience here, like, what can people do that it doesn't cost them anything, doesn't really even take any more time for them to do other than just to be aware of it. So a great little exercise is when we breathe through our nose, all right, just make sure you close your mouth, breathe through your nose, sitting up in a nice posture. What that does, it activates our let me go back to light, slow, and deep. Keep that moniker in mind, okay? A great majority of people who are in chronic pain are overbreathers. So they're not breathing light, they're not breathing slow, and they're not breathing deep. So that affects their biochemistry, puts them in a sympathetic state. It affects their biomechanics, and vice versa. The biomechanics of the spine and the body will affect the breathing. And then also it affects using your diaphragm. That's the deep part of it. So light, we want to breathe less because we don't want to feel like we're breathing shallow. We want to learn how to use the oxygen that we have in our body, because most of the time we have enough oxygen. It's the carbon dioxide part that we're not utilizing. And that's one of those things that's been vilified, right? Like, or not even vilified, but we got to get as much carbon dioxide as possible. We need to get that out so we don't, become acidic in our body. That's not going to happen. Your body knows what state to be in for that homeostasis. So when you breathe,
and that's I think a mechanism that not many of our listeners might even be familiar with, but carbon dioxide is absolutely critical for the acid-base balance. It is a direct medium that helps to balance acid and base, and the rate of your breathing helps to determine that balance.
Mm-hmm.